Hi, everyone. As a urologist with more than 30 years of experience in men's health, I'm Dr. Leila. I specialize in helping elderly men regain their energy in all facets of their lives, not just in the bedroom. You see, I've seen firsthand how ignoring minor changes in our bodies can take away more than we realize: our confidence, our closeness, even our sense of self. I say this as a medical professor who has sat across from innumerable patients who have shared their innermost anxieties. However, what if I told you that the penis ages similarly to your heart, brain, or bones? Ignoring this destroys your dignity and those priceless relationships that give life meaning. I'm here today to help you rewrite that story. Consider this. As a man over 60, you feel as though time has subtly changed the laws for your body. You may have dismissed the fact that things aren't as responsive as they used to be as just getting older. But wait, what if age isn't the true cause of the majority of penile dysfunction in your age group? What if the change could be achieved with a simple, everyday regimen devoid of medications or intrusive therapies? That's what I'm promising you now, based on insights supported by science and designed especially for men like you. In order to protect your well being and rekindle your inner fire, I'll take you through 5 tried and true methods for promoting penile health in this talk. These methods aren't gimmicks. And stay tuned because I'll give you a bonus tip that most physicians don't know about. One that could protect you against a painful condition that many older men unexpectedly encounter. If you haven't already, click the button and enable notifications before we begin. I make these films to empower your health journey with age-appropriate, practical guidance. Additionally, please leave a comment below if something strikes a chord with you or if you would like me to elaborate. Your comments help me better serve you by influencing what I share next. Let's begin, shall we? Let's start with maintaining an active and engaged penis, which is arguably the most neglected yet essential component of penile care as we age. The adage, use it or lose it, has biological roots and isn't just folklore. Hundreds of men in their 60s and beyond who quietly believed their intimate lives were over and accepted a fade-out they believed was inevitable have sought my advice in my practice. Robert, a retired engineer in his late 60s, was one of my patients who came to me feeling hopeless. After his wife's death, he had given up on having sex of any kind because he thought it was part of the deal with growing older. However, he reported better function and a revitalized passion for life within months of implementing modest, regular stimulation. Why? Because inactivity induces what's known as penile atrophy from disuse, a condition far more widespread than people believe. Your penis weakens, loses its elasticity, and the blood flow that keeps it vibrant decreases if you think of it as a muscle group that you haven't worked out in years. Tissues that aren't regularly used don't receive the oxygen and nutrients they need, which causes erectile dysfunction, shrinkage, and decreased sensitivity. Studies from magazines like the Journal of Sexual Medicine back this up. Men who maintain sexual activity, even solo, demonstrate superior tissue health and vascular function. It's about preservation, not about running marathons. For example, masturbation encourages good circulation, just as a daily walk keeps your legs flexible. If it isn't possible at the moment, perhaps because of personal comfort or mobility concerns, take into account medically prescribed instruments like vacuum erection devices, which gently and strain-free promote blood flow. Try the Kegel exercises, often known as pelvic floor exercises, which help improve control during intercourse and strengthen the muscles that support erection. This is where it becomes more profound and goes beyond the physical. Maintaining an active sexual life reinforces your status as a strong, competent man. Emotionally, I've witnessed people like Robert reclaim their swagger and quiet dignity. Honoring who you are now, with all of your knowledge and anecdotes, is more important than trying to relive your 20s. I remember this story from a group exercise I facilitated. After years of neglect, a 72-year-old widower revealed that beginning self-stimulation improved not just his mornings, but also his interactions with friends and family, resulting in a positive cascade of confidence. This is also supported by science. An American Urological Association study found that sexual activity releases endorphins, which improve mood and reduce stress. Don't let myths stop you, fellas. Engage in physical activity in a way that feels appropriate for you and observe how it re-energizes your body and soul. And building on that exercise base, let's move on to something just as important but frequently overlooked, keeping up perfect hygiene that is adapted to your evolving body. Having worked in the industry for more than 30 years, I can tell you that thorough cleaning is a first line of defense against problems that can rapidly worsen in later life. It's not only about freshness. Too many men have come to me in anguish with illnesses or irritations caused by old habits. Consider John, a former athlete who is 65 years old. He took great satisfaction in being low maintenance, but he ignored the subtleties of aging skin, which resulted in a painful balanitis that kept him out of commission for weeks. What worked in your 40s isn't enough today, since in reality, as we age, our skin thins, our immunity wanes, and our healing slows. Dead skin cells, perspiration, and germs, known as smegma, can accumulate beneath the foreskin of uncircumcised males, in particular, increasing the risk of illnesses like balanitis or even penile cancer. Did you know that this malignancy, which is frequently directly linked to persistent irritation, is reported to be frighteningly high in areas with poor hygiene instruction, such as parts of South America? According to a research published in the International Journal of Cancer, maintaining good cleanliness can reduce that risk by as much as 60%. The solution is simple and gentle. Every day, wash with warm water and a light, odorless soap. Since wetness is a breeding ground for bacteria, gently pull back the foreskin if necessary, then rinse well and pat dry. After intimacy, always wash your hands, since lubricants or bodily fluids might upset the natural equilibrium of your skin. The psychological elevation is what many find surprising. A feeling of control and cleanliness penetrates your day when you handle this region with the same attention as you would when brushing your teeth or styling your hair. In my experience, patients say they feel less self-conscious and more confident in social situations. In contrast to the social rumor that older men should become less visible, it is empowering. I've been there with patients who broke the taboo around these subjects, and it's always a turning point toward improved health. So keep in mind that empathy is crucial in this situation. Moving smoothly on, let's talk about a hidden risk that arises during those private moments. Avoiding having sex when you're not completely erect. Although this may seem like simple sense, it's easy to forget in the heat of the moment, and the repercussions could change your life. Men in their 60s and 70s have come to me throughout the years with inexplicable discomfort or curvature, which I've determined to be minor injuries from pushing too soon. Imagine this. Your penis is a complex system of spongy tissues and blood arteries that can only bear pressure when it is stiff. Micro tears, which are first undetectable but eventually build up into scar tissue, are caused by forcing entry or strenuous movement while semi-erect. This accumulation frequently results in Peyronie's disease, a condition in which the penis curves unnaturally, causing pain and making sex difficult or impossible. Up to 10% of men over 50 may be affected, according to the Urology Care Foundation. Yet many suffer in silence because they are unaware of the avoidable cause. I remember a patient, Michael, a 68-year-old artist, who ignored early pain until surgery was necessary to correct the curvature. His experience serves as a reminder of the value of patience. Wait for a full erection, apply a lot of lubricant to reduce friction, and discuss tempo with your partner. Allow assistance, such as ED drugs, to completely function if they are being used. This is about intelligent, well-informed self-care, not weakness. By putting safety first, you protect pleasure and prevent regrets, making intimacy a delight rather than a danger. When it comes to maintaining real connections, we must overlook a contemporary hazard that is subtly eroding the desires of many men: an overdependence on pornography. It's more available than ever in our digital age, and it may seem like harmless escapism to older men who are dealing with routine or loneliness. However, from a therapeutic perspective, I have seen how excess can rewire the brain, reducing arousal in the actual world. During a consultation, a man in his early 70s revealed that although he was married to a lovely woman, he had trouble performing. He later discovered that his daily porn habit had made him insensitive to human contact. On a neurological level, excessive use causes the brain to become overstimulated with dopamine, which dulls the experience of regular closeness. According to Cambridge University research, this can cause erectile dysfunction in otherwise healthy men, which is exacerbated by psychological effects like loneliness and humiliation. I'm not passing judgment. I've compassionately assisted patients in navigating this. Encourage moderation instead. Invest your energy in open communication with partners, emotional foreplay, or fantasy. To rekindle natural sparks, consider sharing a book or getting a sensual massage. Men who have cut back in my practice report stronger ties and renewed libido, demonstrating that desire changes but never goes away with age. It's about balancing the mind and body for genuine enjoyment and choosing contentment above temporary solutions. Ultimately, adopting a holistic lifestyle rather than using short-term medications is the key to long-lasting vitality. I've been treating men over 60 for decades, and I've discovered that no medication can replace the transformational potential of everyday routines. Patients frequently come in looking for a magic bullet, but the biology is obvious. Erections depend on healthy blood flow, hormone balance, and mental clarity, all of which are influenced by lifestyle choices. These aren't just theoretical. Smoking clogs arteries, drinking too much alcohol depletes testosterone, and eating poorly irritates vessels. These behaviors directly harm penile health. According to the American Heart Association, up to 70% of men with heart disease have ED, which is an early indicator of cardiovascular problems. However, there are significant benefits when you tweak the script for the better. According to research published in the New England Journal of Medicine, quitting smoking improves circulation in a matter of weeks, and replacing processed foods with leafy greens, almonds, and omega-rich fish like salmon improves vascular health. Increase your nitric oxide levels for greater erections by adding 30 minutes of vigorous jogging each day. It's like boosting your body's engine. Get 7 to 9 hours of sleep per night to balance hormones. Reduce stress by engaging in hobbies or meditation to lessen the libido-dampening effects of cortisol. Anecdotally, I helped a 62-year-old teacher who changed his habit, substituting herbal tea and evening walks for late-night cocktails. In a matter of months, he was able to wean himself off his ED medications, feeling invigorated and connected. It's empowering because your body reacts to care rather than orders. Make exercise, food, sleep, and connections your top priorities. These are the real creators of vitality, transforming aging into thriving. Now for the promised bonus insight, which is so subtle but powerful that it's hardly ever mentioned. Think of going to bed without your panties. Listen to me from a medical perspective, even though it might raise an eyebrow. Your body heals at night, especially during natural erections that provide penile tissues oxygen. During these instances, tight pajamas or briefs may constrict, resulting in mild friction and decreased blood flow over time, which may promote porones and scar tissue. According to a study published in the British Journal of Urology International, older men's tissue health is positively correlated with looser sleepwear. Choose loose boxers or nudity. It's an easy transition that encourages liberation and renewal. Patients who use this report feeling more comfortable and experiencing fewer irritations, proving that little routines can have a significant impact. To sum up, males, these tactics, maintaining an active lifestyle, emphasizing cleanliness, protecting during intimate moments, limiting access to porn, promoting a healthy lifestyle, and that sleep advice, are more than just checklists. They serve as avenues for regaining your self-worth, self-assurance, and the whole range of life you are entitled to. I've had the honor of assisting guys make these changes, seeing them go from helplessness to strength. A 75-year-old veteran described how these adjustments not only healed his physical ailments, but also restored his marriage, encouraging openness and happiness. Keep in mind that growing older is about adapting, not about losing things. Challenges don't define you, how you respond to them does. If this has made you feel alone, know that it's normal and that change begins today. I appreciate you being here, and let's continue our discussion. You deserve to look after yourself.